The Contra Costa County Board of Supervisors unanimously voted today to put a new sales tax on the June ballot. It's in response to federal and state funding cuts. The proposed tax is 5/8 of a cent per dollar spent and is set to last 5 years. Now, the county estimates this tax will generate about $150 million a year. County officials say those funds would backfill federal cuts to Medicaid and food assistance programs, but could also be used for other county purposes. So tonight we want to go in depth on this new sales tax with John Gioia, Contra Costa County Supervisor. John, always a pleasure to see you. How much do you estimate the county is losing in federal funding?
Heather, thanks for having me on this important issue. We estimate that these Trump healthcare cuts could impact us by over $300 million in cuts to our healthcare system. And this could cause over 50,000 Contra Costans to fall off of healthcare. So what we're really trying to do is protect our residents and working families from these Trump healthcare cuts, which, as we know, were cuts done to pay for tax cuts for the wealthiest Americans. So we're trying to protect families, and the cost of this temporary 5-year measure is only about, we estimate for the average Contra Costans, about $10 a month. So that's our estimate. Obviously, wealthier people buy more and would pay more, but about $10 a month to protect health care for tens of thousands of Contra Costans.
Yeah, it is not just federal funding that you've lost. There's also been a loss in state funding, right? The California legislature taking some actions as well that exacerbated the impacts here.
They have, and all of these, our federal or our healthcare programs and human services programs are funded by federal and state government. So when they cut back, it causes us to have to cut back. But I think a really important point here is that these cuts don't just affect people on Medi-Cal. Think about this: when people fall off of healthcare, they don't have a regular physician, they delay getting their healthcare, they get sicker. They show up in the emergency rooms in larger numbers, which means longer waiting room times for all of us, including those who continue to have health care, and potentially longer emergency transport times in an ambulance. So everyone has to realize that we all pay the price when thousands or tens of thousands of people fall off of health care, get sick, get sicker, and really, put more demands on our system.
Okay, so Supervisor, you mentioned average cost about $10 a month, but how do you convince voters that this is necessary, especially when they're looking at the cost of just about everything increasing?
Yeah. Well, it's a temporary tax, so 5 years and it goes away. We're also seeing that more and more out-of-county shoppers are coming in and shopping in Contra Costa, like in downtown Walnut Creek. So out-of-county residents will be paying some of this, not just county residents. And I think residents in this county have stepped up before to support these types of services, because I think they realize that we all benefit from having good health care. And they may end up paying for this through higher insurance rates if system costs go up. And I think the fact that it's $10 a month for 5 years makes people realize there's an end in sight. But that's not all we're doing. We're also working on tightening our own belt, trying to make our own health system more efficient and cutting our own costs where we can. Even though we've been prudent, we have a AAA bond rating because we've been recognized as running our county efficiently. And we are also going to continue to advocate to reverse these federal cuts with the new administration. So, we're working on a lot of things at once, and this tax measure is just one piece of a larger strategy to protect healthcare and human services and food assistance for working families in Contra Costa.
Supervisor John Gioia, really appreciate the time. Again, supervisors voting today to put this measure on the June ballot. Appreciate the time.
Thank you.
Thank you.
Thanks.